right, hello everyone. Thank you for joining us um, for today's virtual education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop titled Optimizing Your Nutrition During Cancer Treatment. Before we begin, if this is your first time joining us, CSC South Bay's mission is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. Our vision is that everyone impacted by cancer receives the support they want and need throughout their experience. We serve the South Bay, Long Beach, and Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational programs like this workshop. Educational programs are open to all. If you'd like to hear more about our services or join a community, please visit our website at cscsouthbay.org. Before I introduce today's speaker, we ask you to keep your microphone muted to eliminate any distracting background noise. Please feel free to enter any general questions into the chat function found at the bottom of the Zoom window at any time. Without further ado, I'd like to introduce our workshop speaker. Lisa Statner, MS, RDN, CSO, works as an outpatient oncology dietitian at USC Norris Cancer Hospital. She has over 25 years experience helping survivors navigate the often confusing territory of nutrition before, during, and after cancer treatment. She's also a frequent contributor to various media outlets, including Parade Online Magazine and USA Today. Thank you so much, Lisa, for being here with us today.
Thank you, Rebecca. Nice to see everybody here. So let's just jump right in. And I had told Rebecca, feel free to ask questions during the presentation, and I'll stop occasionally to give you that opportunity. So really what we want to cover the objectives for this talk tonight is to identify common nutrition impact systems, or NIS, and I'll be explaining that in just a minute, during cancer treatment. List 4 NIS mitigation strategies during treatment, and explain 2 goals of nutrition interventions during cancer treatment. So just a little bit of background about cancer in itself, which a lot of these things I'm sure many of you are aware of, that approximately 39.3% of men and women will be diagnosed with cancer during their lifetime. In some cases, those numbers are going up. So these statistics are from 2024. 5-year survival rates from cancer has been trending up, which is fantastic, which really shows all of the breakthroughs that have been made through cancer and also lifestyle interventions. The top 5 cancers in the US are breast, prostate, lung, colon, and uterine. And we're definitely seeing a rise with the colorectal cancers as well, especially in younger survivors. The common types of treatment include surgery, chemotherapy, and radiation therapy. And so when I talk about chemotherapy, I'm really lumping in also some of the immunotherapies that are being used as well. And unfortunately, malnutrition has been reported in 30 to 85% of survivors with cancer. And malnutrition can obviously increase treatment toxicities and also decrease quality of life. So what are nutrition impact symptoms? And this is sort of a newer term that's been coined in the last couple of years that we use. And these symptoms due to cancer treatment that can affect your overall nutritional status. So this might include a loss of appetite, changes in taste or smell, constipation, diarrhea, difficulty swallowing, fatigue, nausea and vomiting, dry mouth, and inflammation in the mouth, which is also known as mucositis, and especially with some of our head and neck cancers. So some of the goals, nutrition goals, especially during cancer treatment, is to prevent or even reverse some nutritional deficiencies, maintain quality of life, avoid hospitalization, limit loss of lean body mass, and avoid breaks in treatments, and maintain independence. And what are some of the potential repercussions of these nutrition impact systems? And can any of you guess some of these before I go on? I know I mentioned a few just a minute ago, but I don't know if anyone wants to jump in. So, I would say one of the biggest ones that I see is the potential to pause treatment. So, for instance, if you're receiving radiation treatment and you lose a lot of weight, those beams of radiation won't hit in the same place. And so often what they have to do is reformulate things, and that might delay treatment. In some cases, if you're receiving chemotherapy and you lose too much weight, the treatment might be discontinued altogether. And I don't see that often because nutrition services are part of what we offer at USC. And so myself and my colleague, we work really hard to help maintain weight. And during treatment, it's a lot of muscle loss that we see. And that could be due to the treatment itself, a decrease in appetite, protein needs are much higher during treatment, and also just inactivity. So a lot of times people aren't moving around as much as usual. So if NIS are not addressed, then these can occur. So as I just mentioned, the weight loss. So it can be fat and lean body mass, dehydration, malnutrition, electrolyte imbalances, hospitalization, delayed treatment, and life-threatening consequences. So let's talk a little bit about managing the side effects of cancer treatment. So poor appetite is a big one. And, really for a lot of reasons. It could be the treatment itself, especially with some of the medications. It could be radiation treatment. So usually with radiation, the side effects are wherever you're being radiated and then some of the surrounding tissue. So for instance, if you're being treated for gastric cancers or stomach cancers, obviously, that can affect your appetite. But, honestly, too, the one thing that's not talked about enough, in my opinion, is the stress and depression that can come along with a cancer diagnosis and treatment. It's one of the more stressful things that I can think of that can happen in someone's life is going through cancer treatment. And so that will definitely affect the appetite. A trick that is really helpful and it seems so simple, and that's to have small, frequent meals or snacks. And usually I recommend try and eat something about every 3 hours so that you have about five of those small meals or snacks throughout the day. And if you've ever been on a weight loss diet or tried to lose weight, one of the first things that you eliminate is the snacking. And the other part of that is to eat at regular times. And again, it seems really simple and basic, but there's a good reason for eating at regular times. So our body has what are called anticipatory hormones that get released when we eat at regular times. And the best example I have for that is if ever had a job or a situation where you always had lunch at noon, you always usually get a little bit hungry around 11:30 because your body knows that you'll be eating soon and your body gets ready for digestion. So if you can create sort of that situation where you're eating at regular times, at least you have a little bit of hunger to help drive you eating. Because so many times people say, I didn't eat because I just didn't feel like it, even if they weren't nauseated. But you want to create a little bit, I guess you could say, artificial appetite in that situation. And there certainly are some medications that can stimulate appetite. There's quite a few on the market, and you could talk to your doctor about what would be appropriate for you because some, do have some side effects, and some do interact with some medications. So the small, frequent meals or snacks and eating at regular times really is one of the best strategies to overcome a poor appetite. Um, other things that you can do is supplement with a protein shake or smoothies. Some of the treatments, especially for any of the head and neck or esophageal cancers, eating really becomes a struggle and in many cases painful. And so that's where, you can bring in something like that. I'm a big fan of homemade smoothies because you can really pack in a lot of really healthy nutrition. Certainly there's commercial shakes out there too. People often ask me which brand is the best, and what I say is it's the brand that you'll drink. So if you're really in need of that, but there's nothing like real food. And again, if you're fatigued and you don't have a lot of energy, sometimes it's just easier to drink a shake of some sort. And even with a straw, you can get in a lot more. It takes less effort to drink a shake through a straw. The other thing you can do, thinking about is stacking your calories and protein. So, just like a lot of people like to stack their vitamins and minerals, meaning taking a lot all at one time, you can add calories and protein without increasing volume. So, some things that I love doing is adding things like avocado, adding a nut butter, peanut butter, almond butter to things, drizzling olive oil on things. So adding, it's usually a fat, especially a healthy fat, but adding those to a lot of your foods. Oatmeal is fantastic for doing that too, because you can really add in a lot of extra calories and protein. There's, peanut butter. There's powdered peanut butter now. And like the pictures there above, you could add in some of your fruits or honey, add a protein powder in that way. So everything that you're eating, you want to think, how can I add some more calories and protein to this? Um, then another good trick is to eat some of your high protein foods first while your appetite is at its peak. So, for example, would be, let's say you're eating some chicken or eggs, which are very high protein. It takes a little bit longer for your protein foods to digest than a carbohydrate or a simple carbohydrate. And so you want to get those in first, and then sometimes it's easier to follow up with the carbohydrate. So, does anybody have any questions so far? No?
None
Okay.
so far. Thank you.
Thank you. Taste changes. So this would be, well, there's a couple situations with this. Obviously, a lot of the medications, especially the platinum-based chemotherapies, like cisplatin, carboplatin, often can create sort of a metallic taste in the mouth. Other treatments can cause this too. Sometimes it's really hard to get rid of that. And I'll tell you, so many patients have told me a sparkling water, like a mineral water, club soda with a little lemon, can really help sort of refresh your mouth and get rid of that metallic taste. Some other tricks would be to not use metal utensils, because if you're already having that metal taste in your mouth, you don't want to add more metal. So things like bamboo utensils, chopsticks, plastic cutlery can help. Drinking out of glass or ceramic also can help. So, those little things can really make a big difference. Which are very common in Asian cuisine, often are better tolerated. So that's something to consider. Um, Also, if foods are tasting a little weird, try more bland foods, room temperature foods, foods that don't really have a lot of taste to begin with, because sometimes even just the smell of food is really off-putting. And then also, balance out those flavors. If something's too sweet or too salty, add lemon juice, vinegar, honey if it's a little bit too sweet or too acidic. Some foods I hear a lot that work really well. Soups tend to work really well. Melons work really well for a lot of people. Um, Oatmeal again seems to work great for many people. Pastas that are well cooked, especially like with a pesto sauce. Sometimes the like a tomato sauce is a little bit too acidic for some people. Another scenario where taste will change would be with radiation treatment, especially with any of the head or neck cancers. And very often, temporarily during treatment, people will completely lose their sense of taste. And so eating really, really becomes a challenge then. Some people find if they can smell food, that's actually helpful for them. But in that case where you might temporarily lose your taste, it's a mindset. And you really just have to think of food as medicine. It's not anything that will be entertaining or necessarily enjoyable, but it's just part of your treatment. And you really want to do your best to eat as healthy as you can during those times, especially if there's no taste. One trick that I recommend a lot is, again, using a straw if you can, if you don't have a taste, or often people will say that food tastes like cardboard, but if you're using a straw, and like say with a homemade smoothie, something like that, you bypass your taste buds so you don't really notice so much that there's no flavor. On occasion, or quite a few times, people tell me they can still taste mango. And for what reason, I don't know. I haven't really researched it enough, but there's something about mango that seems to work well for a lot of people. Dry mouth or xerostomia is the medical term for that, is very common with all the treatments, whether it's radiation or any of the chemotherapies. And this can be really challenging, especially for people that are being radiated in the mouth, because they'll have a dry mouth and also a lot of extra phlegm. And so that can really be a challenge. Staying hydrated is key. And if any of you have gone through chemotherapy, everyone nags you, keep drinking fluid. It is really important. Um, Using an electrolyte beverage, I think, is very important because you want that fluid to get into your cells, and that's what the electrolytes help do, really open up your cells. And again, there's so many on the market. Pedialyte is one I like. That's very popular. There's a lot of the powdered electrolyte solutions you could add to your own beverage, or you can even make your own. Try moister foods like the yogurts and puddings, cooked cereals. Watermelon really seems to work fantastic for so many people. And if you cut it into little chunks and keep it in the refrigerator, it dissolves in your mouth and it's very, very refreshing. Frozen grapes is another one, popsicles, soups. So a lot of people are very temperature sensitive during treatment. So either soups or smoothies. I notice people kind of gravitate to one or the other. If it's soups, you definitely want cream soups or puree, your meats in there, your chickens in there, add eggs, things like that. So you want to always be, boosting up that nutrition. Taking small sips of liquid, with each bite of food sometimes is very helpful as well. And you want to limit alcohol and any mouthwashes that have alcohol in them because that is so drying. One thing about dry mouth that's important. So, we do work with a lot of dentists that work with people going through treatment, and they all really say the same thing that when your mouth is dry, it's a breeding ground for bacteria. So, good oral care is super important during treatment, whether it's chemotherapy or radiation, and if you're having that dry mouth. So, a soft toothbrush, a non-alcohol based mouthwash, or even better, a very diluted salt and baking soda rinse is really helpful. And especially for those people that are experiencing phlegm and a dry mouth at the same time, that salt and baking soda solution, and it's really only about a quarter teaspoon of both to a liter of water. So very diluted. That's going to help keep the bacteria at bay and also help break up that phlegm without drying your mouth too much. So that can be really, really helpful. And you want to brush and rinse after every time you eat something. So that's important. So a lot of people during treatment have a lot of GI problems. right? And so, especially if you're being radiated, anywhere really below the belly button. So, in that case, especially loose stools is very common. But constipation is very common too, even when you're receiving chemotherapy. And in the past, we saw a lot of nausea and vomiting and diarrhea with the chemotherapies. But the good news, I guess you could say, is that the chemotherapies, there's so many newer ones, they're administered differently. And then there's so many great medications for nausea. And so if you're receiving chemotherapy, you're likely taking something like a Zofran, which has been a game changer. And the side effect is constipation. So we see much more constipation with chemotherapy than diarrhea as in the past. So you want to stay on top of that. And again, the stress, the nerves of going through treatment is also going to create that situation and the need for more fluid. So, again, another reason to drink more fluid. In many cases, you might want more fiber. And you're going to get that from fruits and vegetables and whole grains. Exercising is really, really helpful also. If you're being radiated again, below the belly button area, a lot of times people have a lot of gas and bloating, and you might not even feel it, but the radiologist will see it on their screen. And so if you have some gas, it's going to black out the screen, and they really need you to expel that. So going for a short walk before treatment sometimes is really helpful for that. And then also about 4 ounces of prune juice, just warm it up a little bit, and that can be really effective as well. If you need something stronger, definitely talk to your doctor. There's so many stool softeners and laxatives. It's just kind of whatever your doctor, is their favorite, one of choice. Miralax is very common. Senna is very common. Colace is another one. But you definitely want to stay on top of that. Because again, if you're constipated, that's going to affect your appetite, right? So I would say nausea and constipation are the two things that you really have to be diligent and on top of. Diarrhea in some cases too. And again, with some people being radiated, usually we don't say no fiber when you're starting a type of radiation or even chemotherapy. Everyone is really different. And, sometimes, we end up throwing the baby out with the bathwater, so to speak, if we just completely cut out foods before treatment has started. But I will say the most common offenders to promote diarrhea would be lactose, which you would find mostly in liquid milk and ice cream. But yogurt is a great one because it actually is naturally lower in lactose. Some of the harder cheeses are lower in lactose. So, honestly, I've had some people that drink a glass of milk with every meal and they never had a problem during treatment. So, the bottom line is you know your body the best, and you really kind of want to go with that. But definitely the milk and ice cream is what I see as being problematic for some people. Um, and then also you want to include soluble fibers. So, we routinely recommend the old school brat diet with people, the banana, rice, applesauce, and oatmeal is a great one as well. Some people will use psyllium husk, which is the same as Metamucil, or even a probiotic. And so there's definitely a lot out there. Culturelle is just happens to be one that I recommend a lot. And then Benefiber, believe it or not, with the child's dose, which is a half of a teaspoon, is like a prebiotic. So a probiotic, of your choice, and then something like Benefiber together, believe it or not, can really help with loose stools. All right, so here's the big one. But like I said, the antiemetics or the anti-nausea medicines are so fantastic now that, this is not the common side effect for many people now. And it's not to say that you don't have it. And what you usually see, especially with chemotherapy, is everybody has a little window of time where nausea might hit. And so, let's say, for instance, you get your chemotherapy on a Monday, and Wednesday is the day that you start feeling nauseated. So it will be pretty much the same every time, that it'll be Wednesday when you feel it. Because once the steroids wear off, once the anti-nausea medicines wear off that they give you at the time of chemotherapy is different for everybody. And so, what I usually recommend with people is, take your anti-nausea medicines as prescribed, but you can also take them prophylactically or before you get nausea. So if Wednesday is the day, maybe Tuesday night, or, when you first get up on Wednesday morning, can just help knock it out. Because once you have nausea, it's really hard to correct. And you could have a whole day where you're not eating as well. And you really want to maximize your nutrition as much as possible. So again, I mentioned, try and avoid foods that have a very strong smell or flavor. The room temperature foods seem to work a lot better. Um, Crunchy foods often work really well, like toast or crackers, when you are having nausea. And you can certainly eat those with something like hummus or guacamole or peanut butter, something like that. Um, Try not to skip meals, have a little something in your stomach, because sometimes your stomach acids will promote some nausea. And then ginger is great, and many people just use fresh ginger. You can get the crystallized, like the candy. There's ginger teas. Another is, believe it or not, Coca-Cola. If you let it sit out and remove the bubbles, that's actually an old school remedy for nausea. My father's a pharmacist, and that was something they routinely prescribed for nausea. So again, everybody's a little bit different, and be very vocal with your healthcare team, especially your doctor, on the anti-nausea medicines. I would say, from what I see, Zofran works for 90% of people out there. But there's that 10% where they need something different or a different combination. But really, we don't want you being uncomfortable. And nausea is something we just have to knock out, and it can be done. But just be very vocal if something's not working for you, and let your doctor know. Some people have difficulty swallowing, and this especially would be, with a lot of the head and neck cancer. So, what I mean by those types would be laryngeal cancer, tongue cancer, anything in this general area. And many of those cancers, people either have surgery, radiation, and or chemotherapy as well. So again, you want to be really vocal with your healthcare team if you're having any pain, because there's many rinses that can be helpful for this. But eating very soft or moist foods, and I would even say, chew your food really well. And I think we're all guilty of sometimes not chewing well enough. So be very careful with that. Sit up when you're eating, do your best not to be lying down. Cook foods really well. So even though, vegetables might be healthier raw or very al dente, at this time, you might want to cook them a little bit more to just really soften them up and break up those fibers. Avoid foods that might irritate your throat. So I would include with that any very acidic foods, like orange juice for some people is too acidic. Again, alcohol can be very drying. And irritate your throat. Foods that maybe don't get chewed well enough, like nuts or popcorn, something along those lines, could be really irritating. And then also, if your doctor agrees, get a prescription to work with a speech and language pathologist because they can give you exercises to really help with swallowing. They're fantastic. And so I always tell patients the exercises might seem silly, but they do wonders for people. And sometimes they'll have you sing or move your mouth around in funny ways. I mean, it's seems funny, but they're really effective, some of the exercises that they can do. So mucositis is like this inflammation that people get. And again, it's with all the treatments, you can certainly get this. Um, if you're getting radiation, the way I describe it is it's like having a sunburn on the outside and also the inside of your mouth. But many of the chemotherapies, stem cell transplants, all kinds of treatments can cause this inflammation. And that can really make eating difficult and cause a lot of pain for people. Again, practice really good oral care, soft toothbrush, flossing. Many times, it's recommended that they go see a dentist before they start treatment, just to take care of any issues that have been going on. Again, using the mild salt and baking soda rinse instead of like an alcohol-based one. There actually are some aloe vera rinses, like mouthwashes on the market that have been shown to be very helpful as far as kind of calming things down in the mouth. And you can just go online or to any health food store and find those. I've also seen some rinses that have turmeric, which it's very potent for reducing inflammation. Again, use a straw when you're drinking. Avoid foods and beverages that are either too hot or too cold. And then again, this sparkling water with lemon. And again, you know your body the best. So if a food bothers you, stay away from it for a while. If it's not a problem, then it's usually fine. But your body will let you know. So fatigue is probably one of the worst side effects of all the treatment, and they all cause fatigue. Doesn't matter your age, where you're at in life, even how much treatment you're getting, but the fatigue is a big one. Um, so again, staying hydrated is key. One of the first signs of dehydration is fatigue. So another great reason to hydrate. Have a well-balanced diet with, adequate vitamins, minerals, protein, and fiber. So just a general well-balanced diet. And sometimes there is a need for some extra vitamins and minerals. A lot of times I recommend a liquid multivitamin if it doesn't interfere with your treatment, just because it's a little bit easier to get down and it's not another pill to have to take. Do exercise as you're able to and break it up into smaller sessions. So, for instance, if you normally walk 30 minutes a day, do two 15-minute walks. And there's some really good research showing that doing those two smaller sessions a day is really helpful to combat the fatigue, especially from the radiation. With the radiation, it comes on slowly, usually by the end of the second week of treatment. And then the chemotherapy, it can be after your first session. But whatever exercise you can do, and it doesn't have to be formal. Some people clean their house every day. Some people garden every day. So whatever it is you normally do, just stick with that and just try and be really diligent with that because I've seen amazing things with the people that exercise every day. Um, Try and sleep at night as much as you can. Limit the daytime naps. If you need a nap, take a nap by all means. One thing that I didn't mention with the dry mouth or even the mucositis is many people get a humidifier for their bedroom at night, and that can also really help with that dryness because a dry mouth often wakes people up at night, and you need your sleep as much as possible. Consume softer foods so less energy is needed for chewing. There's an expression we have, it's called consuming low energy foods. So, not meaning low calorie, but meaning it takes less effort. So, if you think about if you're eating a steak it takes a lot of effort for chewing. Whereas something like a very well done pasta, it doesn't take a lot of chewing. So think about those kind of foods when you're very tired. Try and avoid too much caffeine. Usually some coffee or tea every day is totally fine during treatment. But too much is going to keep you up. And I don't have to belabor this point, but going through treatment is very stressful. So you're already probably having some anxiety, some stress, some depression going on along with that, which will also add to the fatigue. Maybe try some new activities like yoga, qigong, or any kind of mindfulness work. Qigong is a type of Tai Chi. It's very, very popular in the cancer community because it just helps you slow down. It's not a strenuous exercise. Chair yoga is also very, very popular. You can just go online onto YouTube. I know with some of the cancer support groups, they offer those. Some of the gyms offer chair yoga and qigong. So it doesn't have to be your regular formal activities. So just a quick word about the supplements. There's so many out on the market now, and they're higher doses than what you would find in your food. And so a lot of these high dose antioxidants are usually not recommended if you're receiving radiation treatment. And I know at USC, all of our doctors, including myself, don't recommend them during radiation. So an example would be something like vitamin C, which most people take, roughly 500 or 1,000 milligrams a day. The research is not conclusive on this topic, and I've been following it for 30 years. And so, some studies say that the high dose antioxidants might interfere with the effectiveness of radiation because they're all killing free radicals. And so they seem to compete with the radiation. Some studies say no, there's no effect at all. So we like to err on the side of, let the radiation do its thing. Then when it concludes, usually about a week after, you can go back on whatever you're taking. Now, a lot of people take D. That's when, we let people continue with their D because it's a hormone derivative. But most supplements do have some antioxidant activity. Now, if you're getting antioxidants from your food, like for instance, let's say you're making smoothies with a lot of good stuff in there, there is no evidence that it affects the radiation at all. So don't worry about it with your food. Um, and that's where, something like protein shakes or homemade smoothies can be helpful to get in all those good nutrients. And then again, just let your healthcare team know what you're doing. Sometimes, especially with supplements, they certain supplements have maybe a very mild blood thinning activity. So examples would be green tea extracts, fish oil, even high dose vitamin C. And if you're taking all kinds of supplements like that together, you might have a little bit too much of a blood thinning effect that might be negative in your case, and especially if you're taking some other medications. Um, the NIH has a great database. It's the Natural Medicines database, and you can just look up if there's any interactions with anything that you're doing. Another website the NIH site is a free site. There is a paid site. I believe it's about $60 a year called Consumer Labs, and it's an independent lab. They actually test a lot of supplements that are out there and rate them. And they check to see if there's any heavy metal contamination. They look to make sure that the supplement label actually has what they're claiming. And a lot of popular brands, they test, many times through the years. I've been using this um, website for years. And, a lot of times very popular brands, they say, sorry, didn't pass. And then maybe the next time they test it, they did. So it's a good way. They don't test everything, obviously, that's out on the market. There's so many different brands, but it's a good place to look if you're really looking for a good brand, and you'd be surprised. Some of the ones that are very expensive um, don't pass the test, and they also compare with cost as well. So I was just looking up multivitamins the other day, and the Kirkland brand was one of their top rated ones because it had what they said, and it was the best price. So there was also others that passed, but that's a great site. They also have fantastic articles on different supplements and things out there. So if you are being treated and there isn't a dietitian available to help you through this journey, a few places where you can find one. And so the Academy of Nutrition and Dietetics, they have a tab right at the top when you go to the website that says find an RD. Also, your comprehensive cancer centers often have referrals, and even your oncology team might know some people. And so, like I said, if you're being treated at USC, it's a complimentary service that we offer to our patients going through treatment, whatever that is. And I think a lot of the cancer centers offer that as well now. Unfortunately, insurance does not cover this service, so that's why we offer it complimentary. Okay. Do we have any questions now?
Wonderful. Thank you, Lisa, for such a comprehensive presentation. That was a lot of good information in there. I'm so glad we recorded this.
You're welcome.
If there are any questions, we do have some time. Feel free to put it into the chat, or you can also unmute yourself and I could call on you as well. Maybe you just covered all the bases there, Lisa.
Okay.
All right. I just want to thank you, Lisa, again for your time and expertise in sharing it with our community. Yes. Oh, can you repeat the site for the supplement info? Maybe put in
Oh,
the chat.
sure. Yeah, thanks, Joy. So there's two. There's the National Institute of Health, NIH. They have a natural medicines database where you can look up primarily interactions with supplements and medications you might be taking. And the other one is called Consumer Labs. Yeah, thank you.
All right. Great question. Wonderful. Well, thank you again, Lisa, for your time.
Of course.